Okay, we are going. We are starting. We are starting. You can hear me clearly. Thank you. I think we are live now. Okay. Okay, so I just posted the Facebook link. Hello. Good evening and welcome to today's show. The fourth episode of Medical and Scientific Perspective into Longrich products. I, for one, am super excited and I'm super grateful to every member that tune in here every Friday evening just to learn. I've posted the Facebook link where it's streamed live on the Facebook. So please, let's get to share that. And let's also get to know that you are amazing for just tuning in. You are knowledgeable. You are amazing. You are just the perfect deal. Today, I'm really honored because I really want to hear from two amazing guests. They're just amazing. We have two female, and I think I'll be taking one more or two products at the end of the show. We have two females here who are going to be leading us, teaching us every single thing we need to know about this particular product. But we have amazing products. Let me see products we are taking today. I'm sure you are really interested to hear. We are going to be talking about Afro Super Revive, you know, the whole arthritis, bone pain, stroke, all of them. I really want to hear that because Afro is one of my mother's best products, and I want to know the science and the medical perspective behind it. And I'm actually not the host today. We have a different host who will be joining us very soon. Then we have two amazing persons. We have Pharmacy Joy Rich, an amazing lady all the way from the United States, Virginia. Please let's have her say hi. Joy Rich, are you there? Yes, she is.
Everyone. Hi.
Everyone. Welcome. And we also have in our midst Dr. Mercy. You know, we had her the last two episodes. She was standing in from Dr. Agatha. Today she's taking in her stage and she's looking so beautiful. So let's have her say hi to us.
Hi everyone, good to be with you again. Good evening.
Good evening. Thank you so much for joining. Okay, so now we are about to start. We are going to be calling our first host, but I have to read their both profile. One last time, I would like us to share this link to our our friends, our colleagues, our customers, our prospects, because I'm sure the other link had gone far. But we had to change this under 9 minutes because of some technical difficulties. But please share this and invite a lot of your friends. So let's start with our first speaker. Before I introduce her, I met her on Facebook. I met her, I was following a mentor online, and I met her in Nigeria following the same mentor. I'm like, who is this amazing lady? And I went and checked her out. She was all things curiosity marketing, and that attracted me to her. And to know she's in the medical field, so I'm like, oh really? I love you already. But who is she? Her name is Joy Onyinye Nwekwe. She's popularly known as Joy Rich. She's a wife to an amazing husband and mother of 3 handsome boys. I can imagine. She's a pharmacy graduate of University of Nigeria in Nsukka. She worked with Howard University Center for Pharmacy Education, which is HUPEC, under strengthening integrative delivery for HIV and AIDS services, CDAS. I think that's what I'm working right now. Wow. The organization, yes. The organization is into HIV and AIDS services, providing healthcare covering several African countries. She also worked as a superintendent pharmacy for some pharmaceutical companies and community pharmacies in Nigeria. Currently, she's a compounding pharmacist at Alexandra Compounding Pharmacy, United States. She's a Diamond 5 and Diamond 6 with Longrich Bioscience Nigeria International, Nigeria and USA respectively. That is the lady pushing Vision 2023. Please help me welcome Pharmacy Joy Rich. Welcome her in the chat. Welcome her in the chat. Welcome her in the chat. Thank you. Welcome her in the chat while we welcome our second host.
You are welcome, ma'am.
Thank you. Thank you, everyone.
Yeah, that's your upline. I can see that. Okay, so we also have here Dr. Mercy Obo. Her name is Dr. Miss Mercy Obo. She's a doctor in the University of Benin Teaching Hospital and a lecturer in University of Benin. Amazing. She was introduced to Longrich by her elder sister, Dr. Agatha Diden, a two-star director with Longrich. She's passionate about youth development and girl child education. Hence, she founded the NGO called Complete Life Girl Child Education and Youth Empowerment Foundation. Registered with Corporate Affairs Commission of Nigeria. She is a God-fearing lady, highly motivated and positive-minded person. She is married, happily married to a handsome man with children. Please let's welcome her in the chat again. Welcome, 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 welcome.
Thank you so much. Thank you.
Okay, so today we'll start with our very first speaker. Our very first, I can see a whole lot of vibes happening on Facebook. So we'll take more of our questions from Facebook and here on Zoom. But let's also have this happening. So let's welcome Dr. Doctor, I'm giving you doctor. You should go for PhD very soon, Joy Rich. So let's welcome Pharmacy Joy Rich as she takes us to a beautiful level talking about one of my amazing products, Afro Revive and other products. You have the stage, ma'am.
Okay, so I can share my screen, right?
Yes, you can.
Okay. Okay, can you see my screen now?
Not yet.
Yes, I can. I can see your screen.
Okay, so you guys all know me. I'm Joy Rich. I'm a pharmacist, entrepreneur, compreneur. So I'm going to talk about Afro today. You know, this is a wonderful supplement I like so much because it's all natural and the supplement that most people need, and most people will eventually need at one point in time, you know. So because it's very good and it helps in so many things like our joints, because as we are growing old, our bodies are not able to produce certain things, the substances that help the body. For example, as we are growing old, some people start having joint pains, body pains, you know. So this is going to help us very well. So Longrich Afro Super Revive contains highly potent glucosamine and chondroitin, which are essential nutrients for maintaining healthy joints. You know, in our day-to-day activities, we'll have our joints are moving. So, but we don't feel the friction of our joints moving because of the fluid, the cartilages in our joints. So this product, the nutrients, glucosamine and chondroitin, they support the body's ability to regenerate and rebuild cartilage. Cartilage is holds bone to bone, like different parts of our body, in our hips, even our ear is a cartilage, our nose, you know, we have in different parts of our body, our knees. So this Afro helps. It contains other potent anti-inflammatory agents like the green tea extracts. So these are the main ingredients we have in the Afro Super Revive. We have the chondroitin sulfate, the glucosamine hydrochloride, ginger extract, and the green tea extract. The chondroitin sulfate and the glucosamine play important role in growth and repair of cartilage. I've said that before. Cartilage is a connective tissue found in many parts of the body. It is found in joints, the rib cage, the ears, nose, and throat, etc. So, what are the functions of the cartilage? We have cartilage often serves the purpose of holding bones in the body. It ensures bones move smoothly in joints and prevents them from rubbing together. Cartilage cushions loads and impacts of our body weight in order to prevent bone damage. It means that cartilage acts as a shock absorber, cushioning areas where bones meet bones to prevent abrasion, that's tear and wear. Cartilages coat the surfaces of these bones in our joints and cushions the bones against impacts. Each of our daily activities engages multiple joints in our body. Bones move against bones in our joints. We have no sense of friction during these movements because of the cartilages in those joints. Now, this picture, if you can see this picture here, we have a normal joint. We have a joint that have some diseases. In these normal joints, when you look here, you're going to see the cartilage. The cartilage is between these two bones. It's preventing these two bones from rubbing each other. But when we have osteoarthritis or disease of the joints where the cartilage has been damaged by infection or autoimmune diseases, you see that the cartilage is this second bones now, you see that there is no cartilage here anymore. You see, these two bones are touching each other, and the person that has this bone, the person will be feeling pains and the difficulty moving those joints. That's why you see some old people, as they're aging, you see some of them, their legs will turn into K because of the damage in their joints and bones. This is what happens in those joints. So now this is where our Afro comes in. Our Afro Revive helps in the regeneration of the cartilage. It helps the body to rebuild the synovial fluid, the capsules, the ligaments, the cartilage, the synovial membrane. This is a healthy joint. See, the cartilage is intact. The bones are not rubbing together thanks to the cartilage. So what our Afro Sup Revive does is it helps the body to maintain these cartilages. If the ones that are damaged, it prevents the cartilage from deteriorating further. It helps also to reduce pain and inflammation, courtesy of the green tea extract and the ginger extract that has anti-inflammatory properties in them. So these are glucosamine occurs naturally in the body, but the level falls as people get older. As we get older, over time, there's a reduction in the level of the glucosamine in the body. Even some people that are not even old, there are people that are not old that still have a reduction. Maybe some diseases like autoimmune disease, the body attacking the antibodies in the body attacking some parts of the body. That's autoimmune disease. So it can lead to the levels of glucosamine coming down. So risk factors that can lead to this cartilage damage includes age, being overweight, stress on joints, and genetic defects. So there are some people that are overweight that are having joint issues. These are the risk factors that can lead to cartilage damage. Also, cartilage can also be damaged by injury. Like that, I had arthritis when I was 18 years old as a result of injury. So because I was traveling from Anambra to Enugu State, and in the bus I was carrying my box on my laps. The box rested on my knees for the long journey. So when I got down from the bus, I started having pains on my knees. I couldn't walk. So when we went to the hospital, the doctor diagnosed arthritis. So the cartilage tissues can be damaged by injury. So now, but I was treated, everything, I got better. I'm no longer having those pains anymore. So when the cartilage tissues are damaged, and if it's not treated, it can result to arthritis, inflammation of the joints. So chondroitin sulfate, I'm still talking about the uses, the benefits. Chondroitin sulfate and glucosamine, they play an important role in growth and repair of the cartilage. Also, these chondroitin can be gotten from the food we eat, like the bone broth, the chicken, fish, and egg. But you know that we are now in the generation of fast food. So many people, we don't eat whole food anymore. Lots of people are eating Indomie. They don't eat whole food anymore. So you see that most of us are lacking in those nutrients that will help the body.
I had to mute everyone, so please unmute yourself again.
Okay. So like the chondroitin sulfate and glucosamine, these are naturally occurring nutrients that we see them in our food we eat, like egg, the chicken, the bone broth. But the problem is that now people don't eat whole food anymore. We are in microwave generation. People just microwave things, fast food, Indomie, we eat. So many people are deficient in these important nutrients in our body. So now that's why we use these supplements to supplement. You can buy it for your aged parents. Your people can use it as gifts. It helps a lot helps the body to repair the cartilage. It delivers nutrients to the joint cartilage. It inhibits enzymes that decompose the joints. Like I showed you guys in the previous picture, the joint, the cartilage there is no more cartilage in those two joints. The bones are rubbing together, and the person will be in serious pain because of the friction between the two bones and the inflammation. So supplementing with Arthros Super Revive will help to deliver the nutrients required for the rebuilding cartilage and the synovial fluid. Synovial fluid is like brake fluid that lubricates the joints. So these chondroitin and glucosamine are also components of the synovial fluid that lubricates the joints. So this Arthros Super Revive helps to alleviate existing joint pain. If you have joint pain, and those pains can maybe as a result of the inflammation. So this will help to resolve the inflammation you have in the joints. So this is the ginger and the tea and ginger and green tea extract. They also, this is the other two components of Arthros Super Revive. We've talked about the glucosamine and the chondroitin. So we're going to talk about the ginger and the green tea extract. These two, they contain antioxidants that reduces the formation of free radicals that damage cells. In our previous the previous episode of this presentation, we have talked a lot about antioxidants, antioxidants. Most of our products have this effect. You know, this ginger tea and green tea extract, they also have antioxidant effect. They help to mop up free radicals that damage our cells. So because like we saw that the cartilage was damaged. One of the things that damages the cartilage is those free radicals. These free radicals that the reactive oxygen species that damage the cells in the body. So the ginger and the green tea extract helps to reduce the formation of these free radicals that damage our cells. They reduce inflammation, reduce stress, and reduce muscle pain. So why do we use Arthro supplements? Why I love it because the ingredients are natural. The ginger, the green tea extract, the chondroitin and glucosamine, they are natural. That's why I love this product, the Arthro supplement. There is no artificial ingredients in it that will make you that will cause any adverse effects on you or any side effects. So this is why I love this product. So I'm going to head to the next product, which is a bamboo charcoal soap. This is one of my favorites, bamboo charcoal soap. So these are the ingredients in our bamboo charcoal. So we have the bamboo charcoal, the honey, the coconut oil, and the saccharose. So now, what are the uses of this bamboo charcoal? Bamboo charcoal ingredients, it absorbs dirt and removes excess grease. we all know that charcoal is absorbs toxins. So as when we use this soap, it helps to absorb dirt and grit from our bodies. It restores our complexion. It removes dead cells from us. It helps to remedy for pimple, blackheads, and acne. And it also helps to treat sunburn. Now, this continued. Activated charcoal enters the pores of the skin, absorbs the impurities and harmful substances on the skin, and it causes deep cleansing and also removes skin odor. Then the coconut oil plays a great role in moisturizing. It also has some antifungal properties. Then the aloe essence contains a lot of amino acids, vitamins to improve skin repair. The tea essence is a strong antioxidant. Also, we've talked about antioxidants. Antioxidants helps to mop free radicals that damage our cells. It has anti-aging effects due to its polyphenol content. The polyphenol, that's what has the antioxidant effects. So this is our bamboo charcoal soap. This is how it helps. You see how it enters the pores of the skin to remove the blackheads and helps to restore your complexion, remove the dirt and absorb all those bad stuff. The coconut oil has the antibacterial, antifungal effects. So these are the two products I've talked about today. So I think if you have any question, you can ask. I'm done with my presentation.
Thank you, thank you, thank you. That was very, 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 very fast. So should have even given you more products. I think so. We're going to have you again before the end of this. So, okay, so people, we are live on Facebook, and a lot of people are hosting watch party. So please go to your watch party and get questions and come in here. We're going to be taking as much questions as we can. What did I do? We're going to be taking as much question as we can. Okay, so please just keep allowing it. We're going to take the second presenter now. I think today is going to be a very quick, smart, fast day. What's happening? So we're going to take the Pharmacy Joy Rich. Can you please share your screen for now, so that we could have yes. Okay, so please keep the questions coming. All the questions you have for Afro, for bamboo soap, just keep it coming. She will come back and take the answers. You know how we do it over here. So now we are eager to hear from Dr. Mercy Oko as she takes all the other products she has. So please give it up for Dr. Mercy. Dr. Mercy, you have this floor right now.
All right, good evening, everyone. Let me quickly share. Okay. Hope I can go on, Dr. Esther. Hello.
Okay. Are you using phone?
Yes.
Yeah, I'm here. Okay, let's go on.
Okay. Good evening, everyone.
Go on, ma'am. Go on, ma'am. Good evening. Welcome.
Thank you. I'll be talking about Longrich toothpaste and Longrich mouth freshener. So I'm starting with the toothpaste. This is the popular Longrich toothpaste, very popular. And I'm going to be talking from a personal experience because I use it with my family. Very good, wonderful. It gives me 24-hour fresh breath, very fresh, and is highly recommended for everyone. So I will quickly look at the benefits. As I'm talking about the benefits, I'll be talking about the content, because it's the content and what it does and all that. So it will come with the benefits. Okay. So on looking at Longrich, because when I actually joined Longrich, when my sister introduced me, the first product I used was this Longrich toothpaste, and since then I've been hooked. I've been using it because, like I said, it actually gives 24-hour fresh breath. when people complain halitosis means mouth odor or bad breath, oral odor, I think the best thing to just give them initially, say, try Longrich toothpaste. It's really good. It helps. It keeps the mouth fresh the whole day. And when you start brushing twice daily, like we say, when you now use it twice daily, morning and evening, you can be sure that you are saying goodbye to halitosis, to mouth odor, to bad breath, and all that. Is very good. So for the benefits of Longrich toothpaste, it can be used for the treatment of tooth pain. Because like when you have holes in the teeth that we call dental caries, what causes it? Acid are produced in the mouth, and those acid, they act upon all those sugary substance. People that take all this fast food and all that, they are broken down. Acid is released, and the bacteria in this mouth will act on those acid to cause decay. They demineralize the component of the tooth. The tooth is made up of the dentine, is surrounded by the enamel, and inside the gum, you have the root. So what acid does in the mouth, that because acid can destroy things, it destroys the enamel first, goes to the dentine and create a hole there. But using Longrich toothpaste, and from that hole, you will now have, when there's a hole in the tooth, once it gets to dentine is very sensitive. That's when you look at your mouth, the first part you see of the tooth is called the enamel.
Dr. Messi?
Yes. Hello?
Dr. Messi?
Yes, I'm here.
Would you mind we share from the laptop, because people on Facebook are complaining that it's very tiny. The write-up are tiny.
Okay.
Let me share for you.
Okay.
Just on share, and I already have it here, so I will just go ahead and share for you.
Okay.
Can you see now?
Yes, I can.
Is this better?
Okay.
Yes, okay.
Okay. I was actually
okay, please, let's continue.
Okay. Like I said, for the treatment of like I was explaining what causes tooth pain. First of all, you have ache, you have a hole in the tooth. Then as it gets to the dentine, it can cause tooth pain. So the benefit of using Longrich toothpaste is it contains green tea. And this green tea is a powerful anti-inflammatory agent that can combat the acid that are released in the mouth. It has anti-inflammatory agent because the bacteria will act on all this sugary food in the mouth. That's why we say all this sugary food reducing.
The door is locked.
Sorry about that. Okay. Really sorry about that.
Okay. So
unmute yourself again.
Okay. So the green tea the Longrich toothpaste has this green tea that has powerful anti-inflammatory agent that can combat the effect of all this acid release and makes your the tooth strong enough to resist decay. How does it do this? It works together with calcium glycerophosphate to combat toothache. Because as the hole is created, when we started giving Longrich, people look at it and said, oh, it doesn't have fluoride, because we know when there's a decay, the fluoride in normal toothpaste will be released. It will now seed those, so it will form fluorohydroxyapatite and seed those holes. But this calcium glycerophosphate in Longrich is good enough to seed those holes that are being created. It can also form calcium hydroxyapatite and seed those holes. So once those holes are sealed, the dentine cannot be reached and the toothache is relieved. And even for the weak gum too, because the green tea, we have mentioned the benefit of green tea. In my past presentation 2 weeks ago, I mentioned the anti-inflammatory, antioxidant, and all that. All this anti-inflammatory, because in the mouth, normally in the mouth, you have so many microbacteria, microorganisms. There are over 400 species, bacteria, fungi, and the rest of them. So you have to maintain the balance. But when somebody is not having weak gum and all that, that shows that there's a problem with more bacteria they're produced, and they can affect the gum. And when you have deposits, people have deposits in their mouth, like all those plaque and calculus, and they contain bacteria that can affect the gum, make it weak, and make it useless, and make it painful. The gum at that point is not so useful because it's weak. But because of this green tea, which is an important component of the Longrich toothpaste, it helps in anti-inflammatory action against the toxins that are released by this bacteria. Hence, it will strengthen the gum and strengthen the tooth and prevent a toothache. Next slide, please. Next slide, please.
Yeah.
Okay, and like I said, that people have been arguing that okay, Longrich is fluoride free and all that. Longrich is fluoride free, but we have there's aloe vera in it, the green tea, and we also have this white tea extract in it that can strengthen the tooth. Like I said, it can form calcium hydroxyapatite that can seal up and prevent holes and prevent decay. So it's not lacking the benefit that you will obtain from this normal fluoride containing. No, even Longrich has been argued from research that is even 5 times superior to those fluoride containing toothpaste. It also contains strontium chloride. What does it do? It helps to build strong teeth and prevents sensitivity. Some patients complain, oh, my teeth are shocking because the dentine is exposed. The tooth will be shocking and all that once the dentine is exposed. But because of this strontium chloride in Longrich, it can seal up all those dentinal pores in dentine that will lead to all these shocking. People will say, when I drink cold water, it shocks me. When I drink hot water, it shocks me. But because of the strontium chloride in Longrich toothpaste, it seals up all those holes and prevents the sensitivity. It also contains antioxidant, the green tea, anti-carcinogenic properties of green tea. It contains other antibacterial like triclosan, which is an antibacterial that can help to fight, because like I said, the mouth is made up of so microorganisms. That's how God created the mouth, so many microorganisms, but they put themselves in check and balance. Because there's a balance control in the mouth, microorganisms cannot say, okay, let me destroy the gum. There's a balance. But if anything should upset the balance, you see disease, caries can come, weak gum can come, so many other problems can come. So because Longrich toothpaste has all these antibacterial, the aloe vera, the green tea, and the strontium chloride, all this can help in fighting the toxins that are released by these microorganisms because they have antibacterial. Please, next slide. Please, next slide. Okay, then another benefit of Longrich is it has this buffering action. The trisodium phosphate contained in the toothpaste helps to maintain the weak.
Please unmute yourself, Dr. Mercy.
Okay. Okay. Before anybody can complain that, oh, I have toothache, I have there are holes in my tooth, is sensitive, the environment of the mouth must be acidic, because the bacteria working in that environment release acid to cause decay. They cause holes. But because of the buffering action of Longrich, because it has trisodium phosphate, it helps to maintain an alkaline environment that will prevent the formation of acid that can cause those decay. Okay, and also Longrich can reinforce the gum, like I said, because of all those anti-inflammatory, prevent the bacterial action on the gum and prevent all those anti-inflammatory action that can damage the gum. The blend of aloe vera gel and white tea protects the gum and strengthens it and prevents all those gum issues like ulcers, formation of plaque. Plaque is what we call tartar. You will look at some people's mouth, it looks dirty. You have all those deposits, they call plaque and calculus. They are microorganisms and they are products. But because of this aloe vera in it, it can help prevent all those formation or attachment of this tartar, of this deposit to the gum, and makes the gum healthy. Please, next slide. Next slide. Okay, there's something I want to let people know, because we say Sensodyne toothpaste is very popular. Sensodyne made by GlaxoSmithKline, which used to think was made by GSK, but it's of note that Sensodyne toothpaste is made by Longrich. So this to show you how good the one that's even made by Longrich for Longrich will be. So Longrich toothpaste is highly recommended because it has all the function of a good toothpaste and even more. If Sensodyne toothpaste that is popular is made by GlaxoSmithKline, you can imagine that Longrich toothpaste itself will be superior to Sensodyne toothpaste. So it has the benefit of Sensodyne toothpaste, which is to combat sensitivity. It has the benefits of reducing the anti-inflammatory and destructive tendency of the microbacteria in the mouth. It prevents toothache because it creates an alkaline environment in the mouth, preventing acidic environment that can lead to decay of dental tissue, hard tissues. And it keeps the mouth healthy because it has all these components, the structural chlorides, and all of this to keep the mouth healthy. But you should know that please do not swallow, because even for normal toothpaste, do not swallow, because the components there, they are for the dental tissues, they are not for the body. So as much as possible, do not swallow. And if you want to get the maximum, like I said, I use Longrich with my family. It helps me. It prevents mouth odor, what we call halitosis. If you want to get the maximum benefit of Longrich, you have to use it twice a day. Brush your teeth twice a day with your Longrich toothpaste for maximum benefits. This next slide. So that's for Longrich. I will quickly move on to the mouth freshener. Next slide, please. Okay. Next slide, please. Okay. That's a picture of the mouth freshener. We know it helps eradicate mouth odor, bad breath after eating, smoking, and the rest of them. It keeps the mouth fresh, prevent bacteria. It can be used with warm water to relieve cold symptoms in the mouth. It helps because it releases vapor. It has this cooling effect. It keeps the mouth calm. It keeps the mouth healthy. All these are benefits that we look as we go on. Next slide, please. So the content, what's the content of this Longrich mouth freshener? Longrich mouth freshener contains a mix of white teeth, mint essence, peppermint oil, and moisturizing components. Can you hear me, please?
Yes, we can hear you.
Okay. I said the content of white tea, we have to look at the content so that we can get the benefits. The content of white tea, it contains the content of a Longrich mouth freshener. It contains a mix of white tea, mint essence, peppermint oil, and moisturizing components. What are the functions? The white tea in it inhibits the growth of bacteria. It eliminates bad breath, because for somebody to have bad breath, when somebody comes and say I have bad breath, that means is having microorganisms, what we call the anaerobic microorganisms. They are anaerobes, like all those porphyrominal gingival. There are many of them in the mouth. They are natural commensals in the mouth, but when you give them an opportunity to work more than they should do, they will release toxins, they will release smell, sulfuric kind of smell. So this growth of bacteria, Longrich mouth freshener has a white tea that inhibits the growth of bacteria, eliminates bad breath, and promotes healing of the periodontal tissues, and it prevents bleeding gum. So the white tea is very important in the mouth freshener. That's one of the most important parts of the mouth freshener. It inhibits, and once we are able to inhibit bacterial growth in the mouth, we are able to eliminate mouth odor. And so the mint essence, it gives you fresh breath, protects oral health. You know, this fresh, you open your mouth all day, the mouth is fresh. That's the work of the mint. The peppermint oil and moisturizer is to refresh your mouth. So uses, next slide please, uses of mouth freshener. What are the uses? For the Longrich mouth freshener is to eradicate mouth odor and make your breath very fresh after eating, smoking, or drinking. It's important to know that people with mouth odor, they've gone as far. Some patients that will complain, I have mouth odor, I don't know what to do, I've been so well. They have suicidal tendencies. Yes. Patients have complained, my mouth odor is not going anywhere, I don't know what to do. I might kill myself. Some have lost, they stopped going to work. So whenever I talk, people, my colleagues run away from me. Someone said, So you see some mature people, you should be married. So why are you not married at 40? And so you say, because my mouth smells. So who will I it's affecting relationship, affecting social life. That's how bad mouth odor can be. Affects social life, affects relationship, affects your even going to job. People cannot do normal living. Some people are now beginning to have what we call psychological halitosis from just having just bad breath. They are now beginning to have psychological bad breath. They don't really have it, but they think they have it. And because of that one, they keep running away from people. So before it gets to that extent, you can actually use Longrich mouth freshener. It can help to eradicate mouth odor. Use it after eating. For people that smoke, smoking is not good for mouth odor because smoking leaves alcohol in the mouth. Smoking dries up and contributes to mouth odor. So smoking is not even good, and drinking alcohol is not good. If somebody has mouth odor, you should not be taking all these things. But if peradventure you are smoking and drinking, you need Longrich mouth freshener. After smoking, after drinking, you quickly freshen up your breath, and after eating. Longrich mouth freshener has antioxidants and anti-carcinogenic properties of green tea. We have mentioned green tea, how wonderful it is, anti-inflammatory, antioxidant. It destroys radicals produced in the body, and so prevent cancer and all that. It can be used with warm water because of the peppermint oil in it. It has this kind of nectar. It can be used with warm water to relieve cold symptoms through the release of vapor. And for some people, it's be helpful in treating sore throat or nasal congestion because of that. Even the peppermint oil refresh your mouth, refresh the throat, and can help in treating sore throat or nasal congestion. It suppresses the urge to cough, and it creates a sensation of increased openness in nasal passages. You know, when somebody is having nasal congestion, they will say, go and use these metal crystals. You put it in hot water, it releases a kind of metal-like feeling, and it opens your passage. That's how this mouth freshener, apart from keeping the mouth fresh, it has this peppermint, this metal-like feeling that when you puff in your mouth to rinse the mouth, it can actually increase your ability to breathe, increase the passage for patients that are suffering from nasal congestion. So because of that, it's great for patients with asthma. It can stimulate the body's co-receptors, producing a cooling sensation when inhaled. It also helps to control the perception of pain. It's effective in treating cough in children. Why? Because it relaxes the airway, the passages, relaxes the airway, helps the lungs to relax. So it's as good as an emulsifier, help the passage to relax, help all those things that are causing congestion to come out, to flow out, all those catarrhs, sputum, everything, clears it. So apart from making the mouth very fresh, because the respiratory tract is close to the mouth, it can also freshen your respiratory tract, open it up for you for proper drainage, proper breathing, and so helps the lung to relax. Next slide, please. And next slide. It also protects the teeth and gums by killing bacteria, which can cause tooth decay, gum problems, and plaque. What do I mean? Because it has this the white tea, which has anti-inflammatory, antioxidant, which is very good. Like I've discovered that most of Longrich product, they actually put that there because of its anti-inflammatory, which we all need. We need anti-inflammatory. The days are so difficult. Body has somehow because of the stress you go through, the body will release toxins. So you need something antioxidant, anti-inflammatory that can combat all these things that are released naturally in the body. So Longrich products, Longrich mouth freshener protects your teeth and gum because it reduces the effect of bacteria, which are normal things in the mouth, and they will produce toxins. That's whatever bacteria are, they will produce toxins. But when you use this Longrich mouth freshener, it can help to combat, to reduce the effect of the bacteria in the mouth. Once bacteria in the mouth, they are reduced, tooth decay will reduce, bad breath will reduce, weak gums and bleeding gums will reduce, and plaque formation, which we call tartar, all those, the people who put their mouth, you see brownish, yellowish on the gum and on the teeth, that's what people call it tartar, but it's called plaque. All those things, Longrich mouth freshener can help reduce this, and it restores your fresh breath confidence, because now there's a social disability associated with bad breath. People that have bad breath, you see, they lack confidence. And we've done research among university students and discovered that people that have bad breath score lower grades in their subjects. Why? Because they don't go for lectures. They cannot mix up with their mates and interact and prepare for exam and all that. So at the end, it tests on their result. Why? Because they said, I have bad breath, I have mouth odor, I can't socialize, I can't mix with my mates and all that. So Longrich mouth freshener restores confidence. By the time you use it the way you're supposed to use it, and the mouth becomes fresh, it restores your confidence. You can do your normal thing. and you can live your normal life. So how do you use Longrich? We'll be talking about it, the uses and all that. How do you use Longrich mouth freshener? It should be used after meals or whenever needed. Like say people that smoke and drink. I say smoking, things that can cause bad breath. One of them is smoking, and one of them is taking alcoholic drinks. And one of them is when you don't maintain proper oral hygiene, you don't brush twice daily. Everybody should brush twice daily. And there are some food you can eat, some food that highly, some high protein diets, very high protein diets can cause bad breath. So how do you use Longrich mouth freshener? You should use after meals or whenever needed. How do you use it? You hold it vertically straight and spray directly into the mouth. Do not use when smoking because it contains ethanol. It's inflammable, so do not use when smoking. And do not spray to the eye, it can irritate the eye. And please use with caution, like everything, use with caution. You know, everything you have to use with caution. It's not that you don't use Longrich mouth freshener for life. No, when you are using it, use if you are having mouth odor, see the dentist and combine it for the period they are treating you. It's not something because it has antibacterial in it. Once you continue to use Longrich mouth freshener every time you use it, you will reduce all the bacteria in your mouth that are causing bad breath, that are causing decay and all that. You will not leave the fungi in the mouth. So, and they will cause things like all those church candida acids in the mouth. So you use with balance. So that brings me to the next slide, which is my recommendation. Next slide, please. Next slide, please. Next slide, Dr. Esther, recommendation. So how do you, what is my recommendation for this Longrich? No matter how beautiful, how wonderful it was, it can combat and it also reduce the effect of bacteria and all that.
It's loading.
Mouth freshener should be used with care to maintain the oral balance. Like I told you, there are more than 400 microorganisms in the mouth. Some are bacteria, fungal organism, and other organism. And Longrich mouth freshener has more of antibacterial action because it's the bacterial organism, the anaerobic bacteria that are responsible for bad breath. And when you start using Longrich mouth freshener for a very long time, it will reduce all the bacteria and they might leaving the fungi and the other organism. And that's why you're not having all those opportunistic infection. So you use Longrich mouth freshener with care. You use it, the guidance. You use it if there's a bad breath, then see the dentist. If you have deposit in your mouth, holes in your mouth that needs to be filled, and having food deposit that is causing bad breath, because when you have holes in the mouth, food will enter and they are broken down by the bacteria in the mouth to release bad odor. So you see the dentist, they will fill all those holes, they will clean them out. They will clean your teeth, what they call scaling and polishing. They will clean your teeth with some instrument, remove all those tartar that can harbor bacteria that will cause smell. And then at that period, you use your Longrich mouth freshener along with it and maintain your proper oral hygiene. And you say bye-bye to mouth odor. But it's not something you continue to use for life. It's something you use with care so that you can continue to maintain the oral balance, because that's the essence of Longrich, to add value to life and not to reduce. So you use Longrich mouth freshener with care. It gives you the maximum benefit when you use with care, use when needed and not every time or forever. So that's my presentation on Longrich toothpaste and Longrich mouth freshener. Thank you everyone for listening. Dr. Esther, I'm done.
Okay, so today was meant to be sharp. Okay, we have our co-host here. She really had to come in. Hi, people. Please say hi.
I've been in here, but I just had to hide my face because of other distractions. So, but I've been here.
We missed you.
I want to believe you all learned a lot. Thank you so much, Farm Joy Rich, and thank you, Dr. Messi. Amazing. Even though it was sharp, we got to the point. You know, when you just do brief, but you're just hitting the nail on the head. You know, so many revelations. I learned something from Joy Rich's presentation, and I just learned like 5 new things from Dr. Messi's presentation about the toothpaste and the mouth freshener. So thank you so much, doctors. Really appreciate this. Thank you. Back to you, Dr.
Go.
Surely you are the owner of this stage. Remember.
Please unmute yourself, Dr. Esther. I've just done something I should have done long ago.
Thank you. I said that you are the owner of this stage, remember?
Yes, I am.
So we are waiting for you to take over your stage. We are not going.
Oh,
We have some questions already.
oh my gosh. So many questions I can see here, but people, please remember that if your question is not related to the product of the day, we will not be able to anchor it, number one. Number two, please do not come here and ask us questions for critical products to use for critical conditions. We will ignore you. We've always read the disclaimer, and we are not docs. We are not claiming to be a consultant on this call. What we're just trying to do is to expose you to the preventive uses of Longrich products. Uses of Longrich products for preventive health care. And like we always say, if you're fortunate and you got a result from using Longrich products, it is not the Longrich products that gave you that cure. It is your body that gave you the cure. What the Longrich products did was assist your body to do what it was meant to do in the first place. Maybe there was a lost nutrient, just like Rich said today, that has been replenished. And because of that, your body self-healed. So we don't want to see in the questions today, people asking things like, there's someone right now who is in stage 4 diabetes, stage 4 cancer, what Longrich products can we use? We don't have. The person is far beyond Longrich products. Early stages, you can help your body reset its defense mechanism. But when it is later on, please do not ask us. We will not be able to respond. Secondly, if the name of the illness is too big, it means it needs to see a doctor who understands the name. So we will not answer you. No one is going to do a free consultation here, even if we know what the answer is. So please help us. We want to take questions now. Thank God we have a whole 1 hour to take your questions. So we will take as many questions as possible. We may be able to take, Dr. Esther, we should be able to take questions for previous products we've handled, right?
Yes, we should.
Take products or products with questions or products we've handled. But if it's questions for products that we are yet to handle, please wait. Next week should be our grand finale, and that means that we're going to take all the products that we haven't taken this week. So you be prepared for those ones. But all the products that I've taken till this period, we can take your questions. So drop your questions. Those of you on Facebook, we are also watching. You can drop your questions in the comments, and we will take questions both from Facebook and from Zoom here. I think Joy Rich is no longer here.
Okay. Oh, really? While you are sorting her out, I also want to say that you could check for the previous episode. If you need the recording, you could check the YouTube. It's made available on YouTube. I've shared it on the comments, also on Facebook. Then secondly, you could also type your testimonial of any of these products you've had. We can read it out loud. You know, if you had, you've used the toothpaste, you've used the roll-on, you've used the berry oil, Afro, and you had certain good results. You were once noticing this, but after it did this, your body got better. You know, you could share them. I would take pleasure in reading out your testimonial, or possibly even unmuting you for you to say something. But we have 1 hour today, so let's make good use of it.
Yes, please, you can make Joy Rich co-host again. I think she was knocked out of network. So you can make her co-host.
Okay. We have some questions in the chat box already. Well, let me look for her.
Yes, I've seen some questions in the chat box, so maybe we can just start reading it out.
Hi, Dr. Udwa Geteka. Good to see you.
Hi, Doc. Welcome. All right, so Joy Rich, we're starting with you. The questions are going to be for you. Okay, so let's get you to be a co-host so you can unmute yourself, because I had to mute everyone.
Yes.
Okay.
I have made her co-host.
Okay. So we have the first question here. Joy Rich, are you here with us?
Yeah, I'm here.
Okay. Please, can someone with ulcer use the Afro?
Of course. There is no contraindication.
All right, thank you. Someone is asking the dosage for Afro Survivor besides the one on the pack. Is there any?
Use the one on the pack. Use the dosage on the pack.
Okay, so we don't need to
Yes.
reduce or increase for a particular ailment or the other.
No.
Okay, thank you. And then another question is, what side effects does Atro Reviver have? Any side effects?
There is no side effect.
Okay. Yeah,
There is
please.
no the components of Atro is something that occurs naturally in your body. You're just supplementing, you're just helping the body to heal.
Okay.
Yeah, there is no side effect. But keep away from reach of children. You don't have to keep near your children, because your children can take them and something may result. You have to keep away all medicines away from children.
Okay, thank you. All right, Dr. Messi, this one is your question. Can the mouth freshener be used on asthmatic patients? I think she had mentioned that already. Is Dr. Messi still here? If not, we can always come back. I think maybe the network has taken her out.
I think network has taken her out because I'm looking for her.
Yeah, please look for her so you can make her co-host again. She'll unmute herself and respond.
She has lots of questions.
Yes. Okay, so let me skip that and just look for the ones.
People, you can still ask questions about baby series, because we have Dr. Yudi somewhere in this house, so she could still answer her baby series.
Okay, do we have Dr. Chinonso? Is Dr. Nonso here?
Let's see.
Because I know he talked about the cordyceps yesterday. There's a question for cordyceps here. Okay, Dr. Messi is here, but she can't unmute herself. Please find her.
Okay.
Yeah. Talking about the Atro, Rich, talking about the Atro, is it helpful for stroke? That's the question. Is it helpful for stroke?
Well, what Atro does is for the joints. For the joints, for the stroke, you have to meet your doctor to give you drugs for stroke.
Okay. So stroke is not necessarily
Because
joint.
Stroke can be caused when there's a blockage, maybe a blood clot. There's a blockage of the blood vessel. So you need to meet your doctor to determine what is causing that stroke, so that the doctor will know the line of treatment. You don't have. This is a serious case. You don't have to prescribe any Longrich product in case of stroke. You have to meet your doctor first.
Okay. Please, let's all hear that. When stroke is serious, meet the doctor. Some people complained of severe dizziness after taking the Afro, but they are better with reduced dosage. Do you have anything to say to that, Farm Johnny Rich?
With reduced dosage, if you're feeling this, and you feel that you can reduce the dose, no problem. You go with the dose that is good for you.
Okay. All right, thanks, Ramatu, for that. I hope you've gotten that. So it's possible that, yes, maybe there's some reason that you're feeling that way, so you can reduce it. Then there's another one here. Can people allergic to seafood take Atro? I think there's something about it on the back of the Atro.
People allergic to
seafood.
People allergic to seafood.
Yes.
There is no content of Atro that will make you that makes people allergic.
Mm-hmm.
The person run allergy test. The person do allergy test, and he or she is allergic to we have a chondroitin, glucosamine, green tea extract, and ginger extract.
Mm-hmm.
So I don't see any relationship between the allergy to seafood and what we have in Atro.
Okay, thank you. Please, this person that is asking fibroid question, we don't have answer for you. Thank you. Okay, so Dr. Messi, are you able to respond to some questions now?
Yes, I'm here.
All right, thank you. Welcome back.
Thank you.
Yeah, so we have a question that says, can the mouth freshener be used on asthmatic patients?
Like, when I was giving the lecture, I said it's good for the asthma because it opens up the passage and it helps them to breathe and relax. So it's not something that you take in. It just you rinse and you pour out. So it can be used with care. It can.
Oh,
It
so
helps.
freshener is supposed to be used for gargle, not to.
Yes, it's gargle and you pour out. It's not to swallow. You don't gargle and swallow.
Are you
Oh.
serious?
We actually normally just open our mouth and we spray it into our
Yes,
throat.
so
No, all mouth freshener, Longrich and other products, you don't swallow. You rinse, you gargle your mouth, open, take your head backward, you clear the throat, and you spit it out. That's a gargle. Yes.
Wow.
wow.
Thanks for that.
Just hold it to the mouth for like 30 seconds to a minute. It's topical. It's not something to be swallowed.
Okay. Thank you.
Please, Dr. Mercy, you have to start your video so that we could share you. Your video is off. Continue, ma'am.
Okay. How frequent can an asthmatic person use the mouth freshener? I mean, is there a recommended dosage, and is there any likelihood of drug interference since most asthmatics use inhalers and peptides?
And first of all, Longrich mouth freshener is not for the treatment of asthma. Please take note of that. It's a mouth freshener. It's just that added advantage that it opens up the airway passage because it's close to the mouth and it can help. For the asthmatic patient, please, you have to be seeing your doctor regularly to treat asthma. Yes. Longrich mouth freshener is not for the treatment of asthma. It prevents mouth odor, decay, and weak gums. That's the essence. But it can open the passage because of this peppermint oil in it. And it moisturizes the passage. It moisturizes the passage. It's not something that should not take the place priority over your treatment for asthma, please. So asking how long, it's not the treatment. If you are using it for mouth odor and all that, after eating, each meal you take, you eat 3 times a day, so you can eat 3 times a day. And for some time until it takes care of the mouth odor. But for asthmatic patient, take your drugs. Maybe you can use once or twice a day. That should be okay. But it should not take the place of your normal treatment for asthma.
Okay, thank you, Doc. And there's another follow-up question here. It says, Dr. Mercy, if those names you mentioned can seal the hole, why is it that dentists still find it difficult to believe or prescribe our toothpaste, especially in teaching hospitals here in Nigeria?
Let me see. I think Longrich toothpaste is very popular. It's very popular among patients. That's what people don't know. Doctors are prescribing it. Dentists are prescribing it because it's very useful. My lecture on this Longrich toothpaste from personal experience, when I was introduced to it by my sister, like I said, I started using it with my family. It keeps the mouth fresh 24. If you use it for morning and evening, it keeps the mouth fresh 24 hours a day. It's where people are prescribing it, people are using it. It's popular. Any supermarket you enter in Benin, even within the hospital, close opposite where I work, University of British Hospital, you have Longrich everywhere. So people are prescribing it. Because like I said, the white tea extract in it, the calcium in it, can seal up the holes like fluoride would do. So, and it's been found that from research done by Longrich, that is superior to all this fluoride containing, because fluoride is when ingested can cause fluorosis, mottling of teeth. They have side effects. So it's been prescribed. I can assure that people are using it. It's popular. People are beginning to know the effects of Longrich toothpaste. And it's one of the most popular products by Longrich in Nigeria, that Longrich toothpaste.
Yeah.
People are using it,
okay.
Yes.
I would like to add. Can I?
Okay. Go ahead.
Okay, so for why doctors don't get to use, some doctors, not all doctors, don't get to prescribe our toothpaste in the hospital is for 2 reasons. Number one, a doctor doesn't want to be seen as taking the role of the finance officer or taking the role of the pharmacy. And he knows that if I'm prescribing Longrich toothpaste, it's basically a doctor giving it to a patient. So because of that, they are very careful, not because the product itself doesn't work for the patient, it does work, but because they don't want to deal directly with the patient. And in the hospital, that is very not recommended, especially the tertiary hospital, where a patient will meet a doctor and buy a toothpaste rather than go to the pharmacy and get it. Then the second reason, there is this perception that a toothpaste that does not contain fluoride, it's not good for the body. Now, this is one thing. Longrich toothpaste truly is without fluoride, a fluoride. But this is the good thing. You can get fluoride even from the air we breathe, from the water we drink. And you don't even need it in the toothpaste again. Now, you are not having fluoride in the toothpaste. Does not mean you're not taking fluoride. Because yes, you need a certain milligram of fluoride in your body for some body function. But the fluoride you get from water, from the water you drink, from the lead it passes through, it's even enough to even cause some diseases. The third reason about the fluoride is that they now ask, if there is no fluoride, what prevents cavitation in the toothpaste? And I tell what prevents cavitation in our toothpaste is not fluoride. I'm still looking for the, I can't pronounce the big name right now, but it's Longrich has a natural product inside her toothpaste that helps prevent cavitation.
That's xylitol.
Exactly. And that is the major reason why we don't even, we tell you that why we are putting fluoride, why the company puts fluoride in its toothpaste is so that it can prevent cavitation. And Longrich has replaced fluoride with xylitol for that. Thank you.
Farm Joy Rich, I heard you were, I saw you nodding your head. Do you have anything to add to that?
Yes.
Yeah. Okay. I think is this okay? Yeah. What Esther is saying is, Dr. Esther said is true. Like me, like here in United States, they do fluoride polish for children, and I stopped doing it. I don't use fluoride because fluoride is neurotoxic. Fluoride enters the brain and causes brain damage. It causes a lot of things, you know. But because it has been, for a long time, people have been using fluoride toothpaste. We have been told that fluoride helps to prevent cavities, all those stuff. You know, people have been indoctrinated into believing that. So when you bring Longrich product, they will tell you, toothpaste, they tell you that it doesn't have fluoride. Fluoride is actually causing so much damage to our body. So we are even doing people good by telling them to be using Longrich toothpaste and stop using fluoride toothpaste.
Okay, thank you very much.
You.
I actually wanted to say that, add to that, you know, the truth, just like Jerry said, is that it's not because the dentist, I know that there are a lot of dentists that still do not recommend Longrich toothpaste. And the reason they don't recommend it is that they haven't done their research. So it's ignorant.
Exactly.
Dr. Mercy took her time to do a research to find out that there's a replacement for fluoride. Like Joy Rich said, is indoctrination. The only thing we've always known that will help with cavitation is fluoride. And so as long as there's no fluoride, there's risk of cavities and holes and all, but that's not true. Longrich took their time to do this research, apart from the xylitol. Even the one, the calcium glycerol phosphates that Dr. Mercy talked about, it does the same job. Longrich tried to put 3 things that will do the same job, just in case one is not doing, the second is doing. So we shouldn't have issues with cavities. The first feedback my husband gave me about Longrich toothpaste was cavities. He had this massive cavity that whenever he eats, something goes in there. Consistently using the toothpaste, that started closing up. So that's a good thing. Dentists know Longrich toothpaste now. They are becoming more aware. If only they could watch this particular video, they could go back and do their research and they will know more. So if you know a dentist, you tag them or you send them the YouTube link. Dr. Esther will share the YouTube link and it will go around in all chat rooms. Send them the YouTube link and tell them to watch it. They should just forward to where Dr. Mercy talked about the toothpaste and listen to it and then go through this question and answers. And they will understand that the Longrich toothpaste has a replacement for fluoride. Now, another thing I wanted to add was that xylitol is one of the most important product item of that toothpaste. You see, xylitol is a natural sugar. Every toothpaste must have sugar. Xylitol is a natural sugar, and Longrich carefully put it in the toothpaste for one reason only, to replace artificial sugar in all the toothpaste. Now, there's a difference. If you look at the biochemical cycle of every sugar, especially the artificial ones, they end up in producing a lot of acids. So when you brush your teeth, the bacteria in your mouth will help to quickly convert all those sugars to acid, and that's what's causing the tooth decay. Now, the xylitol is the only sugar, even among naturally occurring sugars. Sorbitol is naturally occurring too, that doesn't produce acids, but ends up producing reducing equivalents. Now, this may sound too technical for you, but what I'm trying to tell you is that it even reduces the occurrence of acids in the gums and in the mouth after brushing. So we have anti-inflammatory, like Dr. Messi already opined to, in the product. I used to have severe dental issues, bleeding gums, tartar, all of it, because my gums were always inflamed. I remember I had done gum excision like twice, both sides, just cut them off because they're always inflamed. I've done gum excision. I've not pulled any tooth before, but it's always gum issues I have. And that gave me bleeding gum, that gave me tartar. I used to see a dentist twice, 2 times in a month. I must see a dentist and I must pay good money. When I was living in the UK, it was £20 per visit. What does the dentist do? Scrape off the tartar in between my gums and my tooth. In my opinion, that just further widened the hole and just kept leaving food residues in between those gums and tooth. But having used the Longrich toothpaste for just a week, the bleeding gum reduced. It kept reducing until I didn't need to see a dentist again. And that was one of the reasons nobody can tell me anything else about Longrich toothpaste. And please note that before now, I had bought all sorts, different kinds. I was just buying because the dentist was giving me different recommendations. In fact, there was only one that worked. It was strictly anti-tartar. That's the only thing that worked for me. But even the anti-tartar was just reducing the gum bleeding. It did not remove the space between the gum. The tartar was still building up. The plug was still building up. But the Longrich toothpaste has closed it up. My dentition is brighter. Like Dr. Mercy said, the tartar causes browning of teeth. I've been using Longrich toothpaste for almost 7 years now, and my dentition is better. I'm sure you can actually see that. Let me grill you.
Yeah, we can see that.
That the toothpaste works. So we're not just saying, we're just saying that it's replaced, it could do a better job. Now, the other thing I wanted to add, just to end up, is that the Longrich toothpaste, I had someone is sharing a screen. So
oh, really?
I think it's just a mistake. So basically, I hadn't gone to see a dentist since I started using Longrich toothpaste because I felt my dentition was much better, and it was. Now, when we did a general checkup sometime in 2018, I remember by this time I had used the Longrich toothpaste for 5 good years. So I was forced literally to see a dentist just to have my dentition checked. So when before my session, I intentionally told the dentist my history, you know, how I had some gums exercised, how I had to be seeing a dentist quite regularly and all of that. Intentionally told my dentist. Guess what? When he finished checking my dentition, he smiled. He said, "You don't look like you've had any of those issues. Although, yes, I can see at the back there's some form of excision, but your gums don't look inflamed at all." I said, "No, because I have a product I'm now using." He asked me what? I said, Longrich toothpaste. He said, "Oh, that explains it." That's what the dentist told me, that the Longrich toothpaste is the best for inflammation and sensitivity. Although there's an argument about this same thing where he says, however, when it comes to cavities, he wouldn't recommend that. So, and I had to educate him, and I told him, check the CAGP and check the xylitol, just check up the ingredients of the toothpaste, and we'll talk about it. I haven't seen him ever since then, but I believe that will give him some things to think about. So I'm sorry I had to do this long explanation, but I wanted
we needed it. We do need it. Thank you. Thank you.
Okay, so Dr. Messi, I'll be coming back to you because there's another question for you. How do you present to the outside world 2 different toothpaste? One without fluoride, which is the artemisinin, which is the Longrich white tea toothpaste, and the one with fluoride, which is the artemisinin toothpaste. Wouldn't it be double standard? Dr. Messi, are you here? Okay, I don't think she's here. Okay, do we have any of the doctors in the house that can help while we wait?
Hello?
Yes, okay,
Dr.
yeah.
Messi is here.
She's here.
Okay, how do you present to the outside world 2 toothpastes? One without fluoride, which is the white tea toothpaste, and one with fluoride, which is the artemisinin toothpaste. Wouldn't it be double standard?
Okay, it's like the food we eat. It has components that can be good for you and one that is not good for we eat all sorts. We read what we eat and all that. There's nothing wrong for me. There's nothing wrong with using fluoride containing toothpaste.
Yeah.
Longrich doesn't have fluoride. Doesn't mean that others are bad because people are still using it and they're getting maximum effect. But what we are saying that Longrich has white tea that's been found to be superior to even the fluoride in toothpaste. And it has this calcium glycerophosphate that can seal up holes in tooth when there's decay to prevent further decay and help to remineralize the tooth. So Longrich has been found to be superior. I use it with my family. It gives 24 hours fresh breath. It prevents tooth decay and pain because it has components. Strontium chloride is what is essential that people are running to go and buy. So that when you look at the main component, strontium chloride is made by Longrich. And this Longrich toothpaste has strontium chloride and other components that may not be in Sensodyne. So Longrich is a good product because it protects the tooth. It forms, I say, with the calcium glycerophosphate, it forms calcium hydroxyapatite that seals holes in tooth. Longrich has that. So if you tell the person, this is what Longrich has, and this is what, and they say, I want to use fluoride container, oh, well and good. Fluoride can still form fluorohydroxyapatite, while Longrich form calcium hydroxyapatite. It's different mechanism. They do the same way. And one has been found that it can be superior to actually, because fluoride has its own side effect. Fluoride contains, if you ingest it, for children, the minimal dose is 1 to 2 packs per minute. If you take more than ingest it in children, it can cause fluorosis, brittle bones, mottled teeth. The teeth will look brownish and be stained forever. So it has its own side effect. That's why you don't ingest any toothpaste, whether it's Longrich or any other toothpaste. Don't ingest it because it's made for the mouth and not the body. Even the mouth freshener, don't ingest all this in there for the mouth because the mechanism of action is not what the body needs for the mouth. So fluoride toothpaste, I don't have any problem. I'm not condemning one, but Longrich toothpaste is good, superior in some aspects, and it keeps the mouth fresh 24 hours, which every toothpaste should do. Keep the mouth fresh 24 hours, prevent decay, prevent weak gum, and keep the mouth healthy. And that's what Longrich toothpaste is doing. So it's highly recommended.
I think you missed the question, Dr. Esther.
Yeah, she did. She did miss the question.
No,
so back to you, please.
She has answered it because she's saying that it looks like it's double. The question is it double standard? Dr. Esther said it's not. It's not double standard at all. Dr. Messi said it's not double standard. Whichever one is good, it's good. This is what she chose. It doesn't stop you from choosing the Artemisinin toothpaste. We should all know that the Artemisinin toothpaste came years after the Longrich toothpaste, over 12 years after the Whitening toothpaste was out. So it may just be Longrich way of saying, okay, you want fluoride, here is a fluoride toothpaste. We haven't studied it. Maybe in our next presentation, we may be able to tell a little more about the Artemisinin toothpaste.
Yes, we should.
Toothpaste is a bad toothpaste at all. It's also good. Yes, it's got fluoride. We're not saying that fluoride will kill you immediately. We're just saying that overexposure is not good. We know that is not good. But when they say that it's the only important thing to help your dentition work, that's where it's wrong. But if you have that fluoride toothpaste, please use it. My son has very, very serious dental issues. So we have been seeing that we had to be seeing the dentist a lot for him when he was growing up. And at a point, the doctor said, you know what? You need to give him a lot of fluoride-based toothpaste that has a lot of fluoride because the holes are a lot. Now, for that kind of issue, he needs a lot of fluoride-based toothpaste. And that's what we did immediately for him. So I stopped the Longrich toothpaste and I gave him that. Now, the Longrich toothpaste is a natural product, so it works gradually. There's a difference. So if we were in US, just like Dr. Rich said, we would have had a fluoride polishing, and that would have helped him go a long way. So there's a difference. So let's not completely condemn. We're not saying we condemn. We're just saying that the Longrich Whitening toothpaste is better. It saves you from that risk of fluoride toxicity. But if you have other ways of protecting yourself, you're happy. But if people still insist they want fluoride toothpaste, you give them the Artemisinin toothpaste. And this is my opinion. This is really my opinion as well.
Yes. And I think for to compare and contrast the difference, I think let's just hold on till next week. Probably the doctor will do a more deep index research for that. And someone is asking if we have that he's taking Longrich antibiotics. And she's having, I never knew that Longrich had an antibiotics that have been prescribed.
Thank you. I don't even know we have antibiotics too.
do we have an antibiotics? Is it a new product? I want to know, because honestly, I have some. We don't know which of the Longrich antibiotics you take, so please, would like you to tell us which product exactly.
All right, Dr. Mercy, there's another question for you here. Please, I joined late. Please, there is this teaching going on that after brushing, you don't gargle your mouth with water, that we should leave for 15 minutes for effectiveness. Please, how true is this?
Wow.
Dr. Mercy, are you here? I know you are actually multitasking right now.
Okay, so I think she's having mom's life balance.
Yeah, same here. Okay, so
okay. So
go ahead, Dr. Esther. You can take the question for us. Thank you.
Okay, so I'm just trying to think about the mechanism behind that particular practice. You have to leave it for a while. Okay, for me, it's a study I have not really looked into, one, and two is that think about the mechanism behind. I always ask people, if you want to follow any practice or anything happening out there, ask yourself this question: what is your end result? Because if the whole idea is it contains antibacterial, antifungal, green tea and xylitol, you want it to have much more effect, or probably you have scurvy in your mouth, or you have mouth ulcers and you want some healing and remineralization effect, then yes, you can live for 15 minutes. But because something is common out there should not mean that everyone should just follow it. Have a reason for doing that. And I've really not heard the studies yet, and I would like to know the science behind that. But from my science background, I would say it depends on what the person wants. If you have cavity in your teeth and you want more feeling, like you can just, after brushing, you leave the effect of the xylitol to have remineralization. Or if you have a scurvy or you have mouth odor, you could just leave the effect for a while, but you brush it out and spit out. But 15 minutes looks like a long time, but I really don't think that it's recommended for everybody. I don't think so.
I agree.
Dr. Fam Joy Rich, do you have what to add?
No, I don't know. I don't know why. I'm not a dentist, so maybe a dentist would have a better answer for that. I don't know why.
Okay.
I don't understand. To me, I don't get it. If you maybe apply the toothpaste, so sometimes you have some irritations, and then maybe you want to apply the toothpaste and leave for some time. I've seen people do that. I've heard people do that. As long as you won't swallow. But when you brushed, there's this likelihood that you're going to be swallowing. I mean, you're telling me you'll not swallow saliva for 15 minutes, and that's unlikely. So you're basically putting yourself at risk of ingesting the toothpaste. And Dr. Mercy has expressly said that we do not ingest the toothpaste. So if it's just to apply an amount, somewhere where you have an irritation or some reaction of some sort in your, maybe somewhere your gums, because I know the toothpaste is fantastic for gums. So if you want to apply that, that's fine. But I wouldn't say 15 minutes is good enough. Okay, so there's another question here. And this is related to the last week's seminar on cordyceps. So is there any material difference between cordyceps militaris and plus black ginger capsule and the vitamin drink? If the capsule is for men only, what about the drink? This is a very good question. We were offered that drink in China last year. And I remember asking one of the Chinese people, why do we take this? It's got the whole black ginger thinking. But I don't think black ginger is negative for women. It's cordyceps militaris plus black ginger tea. But drink, I haven't seen the drink here, and I didn't on the drink there in China. We didn't have the ingredients. But you see, the black ginger capsule has libau in it, and that's the difference. I doubt the drink has libau in it, but I know the black ginger capsule has libau in it. So it's cordyceps militaris plus libau plus black ginger. But I think the drink doesn't have the liver, and liver is the component that is strictly for men. I hope that explains that part. Okay, so we're looking at other questions. I'm ignoring the fibroid one. Sorry, we don't take that.
Okay, so let me read this one while you are coming.
Okay.
How frequent can an asthmatic patient use mouth freshener? I think this, Famrich, this is for you. Is there any recommendation? Is there any likelihood of drug interference since most asthmatic use inhaler and serotypes?
Okay, yeah, Dr. Messi answered that one. Dr. Messi answered.
Okay.
Yeah. Okay, so Rich, this is for you. Concerning the dosage of Afro, an elderly woman told me that she takes 2 in the morning and 2 at night because 3 in the morning and 3 at night dosage is too strong for her. What can you say about this? But she's responded to this already.
Yeah, let's continue with the lower dose. Yeah.
Yeah, please continue with the lower dose. She has already responded.
Okay.
Okay, someone says, yes, my dentist has them displayed in his office and prescribes it to his patients. Okay. Okay, so the gargling aspect has been explained. Someone is saying, yes, your teeth are lovely, thank you. Can artemisinin toothpaste be used for children? We'll handle that next week. Can the toothpaste be used for whitening brown teeth? I don't know, but it removed my tartar. I believe it should help with whitening. Is Dr. Mercy here to answer that? I don't know if there's any research that shows Longrich toothpaste or any ingredient that can help with the whitening. But I think Dr. Mercy is not here. So when she comes back, we will ask her that particular question. Sorry.
We just know that Longrich toothpaste helps in removal of plaques.
Yes.
When you have plaques in your teeth, so it's very effective.
Is there any difference between the white tea toothpaste 200 grams and the 100 grams? Some people say the small is herbal. Herbal means it will be 100% organic. That's wrong. I don't believe that. Is there a difference? I think I have used both of them, and I think there is a difference. You know, the white tea, the one that has the minty color, what's that color? The number Longrich white tea toothpaste we know of. It's very minty. It's very minty, but the smaller one, the one that has the green stripes, I notice is not as minty. So I want to believe there's a little difference. I haven't taken my time to look on the ingredients. Maybe we need to look at the ingredients on both. And yeah, I haven't looked at it, but if you look at the ingredients on both, you can actually answer your question, to be honest. Yeah. Can I use berry oil with other multivitamins like Centrum? Dr. Esther, can you answer that?
Okay, so yes, I saw the question, and it just depends on the constituents of these other multivitamins. And you know, no matter what you take, you should not try to overdose yourself with lots of vitamins. Longrich berry oil has good has vitamin A, vitamin B, vitamin C, D, E, omega-3, 6, 9, and 7 fatty acid. So yes, you could use them, but we normally say don't take them for too long. So if you are taking berry oil for 1 month, 2 months, 3 months, you can stop and take other multivitamin. But it also depends on the ingredients. So check on the bottle. What ingredient does it contain? Because everybody has a specific required dosage of the particular ingredient our body need per day. So you need to be sure that it doesn't contain that. So.
Okay. All right. So someone is asking on Facebook, is the white tea toothpaste good for a 1-year-old child? Okay, so I don't recommend.
Mercy, is she here?
I think when she comes back, she will alert us. So, but this question about a white tea toothpaste for a 1-year-old child, I'll say no. Personally, I would say no. Yes, it's got no fluoride, but I want to believe that this white tea itself might just be a lot for a child. So there's a basic toothpaste for for babies. And I strongly recommend you use that. Besides, a 1-year-old child will ingest the toothpaste. But when
Yes.
you use the one that is for children, they are sort of safe ingesting it. So until you're sure a child will not ingest the toothpaste, please do not use the Longrich toothpaste for that child. Please, even though it's herbal, it's not everything herbal that we need. Let me use the word herbal. It's not 100% organic, but even though it's got some natural ingredients, it's not everything natural that a child needs. So please, I do not recommend it. All right, someone is saying that I think it helps to whiten your teeth because since I started using the toothpaste, my teeth are getting brighter. So yes. Now I have a question here. Oh, I am in the league of those who call Cordyceps militaris antibiotics. Is it not, Dr. Esther?
Oh, really? Okay, so first, cordyceps is a fungi. Fungi is a living thing, like literally, and it is grown in a tree in a very rare places, So cordyceps is a fungi that has antibiotic effects, anti-carcinogenic effects, and other effects, but you can't classify it as an antibiotics. But because of the effect of the antibiotics, we tell you do not take it for long, except you are taking for other purposes. But if you call it antibiotics and you notice itching in your throat, it obviously can be some allergic reaction from your tooth to food or even to the drug. You could just stop it for a while and always try. See, there's something I have learned in medicine. If you have any causative agent that you take and is causing any symptoms or any disease, withdraw. Find out the problem before you continue or you discontinue totally, because you are loyal to your health and not necessarily to a product.
Thank you. Thank you. That's amazing. So I see Olukayode Odukbe says, Longrich artemisinin has fluoride, but the fluoride is even micro-minimal than the regulated amount of fluoride. And fluoridated toothpaste are for those with the need of fluoride toothpaste. So thanks for that. You're just opining what we said. I appreciate that. So we will look more at Longrich artemisinin toothpaste next week. Okay, can I take, I believe that's what the question was meant to be. Can I take Afro and berry oil together?
Rich Farm, are you here? I'm Joy Rich. Yeah, she is.
Okay.
We can see the baby. Hi, baby. You can unmute yourself. We can't hear you.
Okay. What was the question?
Can I take Afro and berry oil together?
Yes, you can, but you have to. You don't take them together. You can give 1 hour interval.
Oh, okay.
Yeah.
I need to two of them at the same time. We have heard you. We are our presenters. Pharmacist in the making. Okay, so Dr. Esther, the questions, we're done with the questions here on Zoom. I don't know if you have any question on your Facebook end. I've also taken some of the questions on my Facebook end here.
It's just one question I had from my Facebook end. Let me try to read it out.
Okay.
Okay, so can children, I think that has been answered already.
Yeah, the same question for the, okay. Can children
yes.
Okay.
Then what's, oh please, what supplement are good for prostate? Please, we can't answer that here. And prostate is just a gland. It's not a bad thing. Every man has a prostate, you know. So if you're asking for one supplement are good for prostate, any supplement you take for your body is good for prostate. But we don't really know what your question is. Thank you so much, everyone. And let's hear from our speaker if they are here. Dr. Mercy and Fam Joy Rich. We'd like to hear from you. Your last words, not last words, please, your parting words for us.
Okay, thank you. Thank you everyone for the presentation. My presentation, Pharmacist Jerry for the presentation and for the participants. It's been an awesome time. and I've learned so much too. It's good to learn from one another. I've learned so much from our presentation, your contribution, Dr. Heidi contribution, everyone, the questions. And I hope that Longrich gets better and that more people are co-opted into Longrich, because it's a good product and it's very friendly to the body. Thank you, everyone. I appreciate it.
Thank you.
Back to you, Dr. Esther.
Oh, to me? No, I think it's over to Joy Rich.
Okay.
If the children will allow her, they wanted to present some.
Hello, everyone. people that owe me no green. They no green, make I concentrate. Oh. Thank you, everyone, for joining. Thank you.
Thank you.
All right.
Thank you for sharing.
Thanks so much for your time. Thank you. We appreciate it.
All right. Thanks for having me.
All right, so before Dr. Esther gives her closing remarks for this evening, I also want to say thank you to everyone who participated. Even though we had a brief change of links because of technical issues, a lot of us still made it here and on Facebook, and of course, the YouTube link is going to be shared later so we can catch up. So it's an amazing one. Like I always say, you can attend these things and you go back and you sleep and it makes no difference to you. But if you could only share, you will be helping so many people. You will be helping so many lives. If you could only share and tell them to watch at their own time. And that's one beautiful thing about the YouTube link. They can watch anytime and they can learn a lot about the product. And an awareness about the products will help you handle so many objections come your way, and you'll be able to do this. We're so happy we've been able to run through 4 episodes with your support. We should be having our final episode next week. We don't know how long that will take, or maybe another 2 weeks. It depends on what we can handle, because we still have a lot of products to go through. But what we can expect is just your constant, we're here to share with you from our wealth of knowledge. And we just want you to take it all in and also share the knowledge and pass the knowledge. Please do not try to present with these technical details. It does not make any sense if you do not even understand what you are saying. And that's why we're direct the people to watch the videos. But the good news now is that you can handle these objections and you can tell them, no, this is what the doctors said. After research, I'm sure when you've watched all these videos, you will know it is different from any product presentation you've ever heard. And that is because these doctors have taken their time to do research, read publications, to be able to gather enough information about these products. So we hope to see you again next week when we take more products and create more awareness for you. Thank you for always being here for us. Over to you, Dr. Esther. Thank you.
Please, can we thank her so much? Thank you so much. Thank you to every facilitator. Thank you to Dr. Heidi, an amazing co-host. Thank everyone for joining. Thank you for sharing. And she has said every single thing. One thing I would like to give you a sneak peek into next week. The Longrich pad and pant liner. Please get set, because next week we are dealing with it in total. And I'm sure you are very, very expectant. I know a lot of people are asking me, when is pad? When is pad? I'm like, can you just hold on for the flow to continue? So next week, Friday, we are going to be giving you, we don't know how many episodes, because truly we have a whole lot of products we need to talk, but we're going to just see how we're going to share it with other participants. You can be sure for next week, this is going to continue. Share this. One last thing I'd like to tell you is, after you get all the knowledge is power.
Yes.
Applied knowledge is superpower. So when you go and tell someone else, when you go and share it with your prospects will want to just join your business because of your knowledge about the product and the supplement they want to use. So I appeal with everyone here, go and grow your business with this knowledge, because at the end of the day, we're taking supplements, we are changing our brand just because we need more income in our bank accounts. Let's tell ourselves the truth. So go in there and win well. We remain the humble Dr. Esther Udotai and Dr. Heidi Uso as the co-host of this show. Thank you so much for always tuning in. You can unmute yourself now and tell us bye or say your word of gratitude.
Thank you. Thank you, Dr. Heidi.
Thank you,
Thank you,
Doctor.
Dr. Esther.
Thank you,
Doctor.
everyone.
Appreciate you guys.
Oh,
Thank you.
thank you to
Thank
all
you.
the doctors.
Bye.
Thank you.
Talk.
All
Thank
the
you.
doctors
Thank
and
you.
presenters.
I really
Appreciate you.
appreciate. Well done.
Thank you so
Thank
much.
you.
Bye. God bless you.
Excellent for teaching us.
We greet you. Greetings from Liberia.
Wow,
Yeah,
thank
thank
you,
you.
Liberia.
Thank you.
Thank you, Liberia.
Liberia.
Thank you, everyone. Thank you, doctors. We look forward to
Everywhere.
next week. Bye.
Thank you, Dr. Heidi. Thank you, all the doctors. Thank you.
Thank you, Dongo.
Thank you, Dr.
Thank you.
Heidi. Thank you,
Thank you,
Dr.
Dr.
Esther.
Heidi. I'm looking forward to your compensation plan coming up soon.
Yes,
Thank you,
so
right?
From US. Thank you.
Wow, nice. Thank you so much.
Yes, I'm watching from UK. Thank you.
Thank you. Good to have you. Thank you. God bless you all.